Dr. Tushar Patel and Mr. Kiran Kothari, the visionary leaders behind the Health Camp of New Jersey HCNJ, discussed the organization's rich history, accomplishments, collaborations, and their upcoming initiative as the Health Camp celebrates 25 years of its dedicated community healthcare services. Don't miss the inspiring insights and stories from this remarkable interview that will soon air on ITV Gold. For now, enjoy the excerpt. Mr. Kothari,
sure.
To kick things off, can you tell us about the history of the Health Camp of New Jersey, formerly known as the Indian Health Camp of New Jersey? How did it all start and what was the initial goal of the organization?
Yeah, so the history really started with a group of us got together and we were looking at elderly people from India moving here. Those, the baby boomers who came here in 60s and 70s, their parents were now coming here, not just for a visit, but they are living here for a longer period of time. However, they did not have health insurance. That means they were not getting an annual physical that they really should at that age. So we thought that maybe we should do a health camp and provide that health screening for those who are uninsured or somewhere had some insurance but they were underinsured. So they would just not go to a doctor or a physician for a health checkup. So we started in 1998. Our first camp was at Durga Mandir. We did not know how many patients will show up, how many volunteers will show up, but as they say, when you're trying to do noble work, angels show up. Well, that's what happened. We had over 200 patients show up that day.
Wow.
Yeah. And we had doctors came in, the nurses came in, the EKG technicians came in, and just in general, over 50 volunteers came in and helped us organize and administer the first camp. But what we really found out at the end of the day was that almost 20 to 30% of the individuals who came had some form of abnormality. Something like high blood pressure or diabetes, that they had no clue, no symptoms. And so we realized that this is not only important, it's a necessary service for our seniors. So that's how the history got started. So our initial objective became a mission. And then we decided to do more camps. So the second year we did a camp at Durga Mandir, at the Balaji Mandir in Bridgewater, in addition to the Ved Mandir. And then let's fast forward to 2023. Over the last 25 years, we have seen over 12,500 patients.
Wonderful.
And provided totally free, comprehensive health screening, which, if you go out for a health checkup, it costs almost $1,000. Multiply that by 12,500. We have provided to our community over $12 million worth of free service. That's our history. But we are going to do a lot more going forward, right?
Dr. Patel, for the past 25 years, HCNJ has been providing essential healthcare services. Could you share some of the accomplishments during this time, such as how many individuals have been served and the range of services offered to uninsured or underinsured individuals?
So, Nidhi, let me start by thanking ITV Gold, Parikh Worldwide Media, and our good friend, community friend, Dr. Sudhir Parikh, for his continuous support for last 25 years. I am so proud that he's being part of our organization as well by supporting the media part and all the support whenever we need for the coverage for our event. So I'm so thankful to Dr. Parikh for his commitment to our organization and our community. So past 25 years, we have been providing this comprehensive health screening, not only for the medical side, but for the dental and the mental health. And so far we have served, like Mr. Kothari said, more than 12,500 individuals and detected close to 4,000 chronic disease abnormalities. So our health screening, our fares are included the blood test, cardiogram, cardiology evaluation, physical exam, dental exam, mental health screening, pharmacy evaluation, medication management, influenza vaccination, female health care, and so many other ancillary services. So our health screening are about 6 to 8 hours every time when we do. And we get 100, 200, 300 patients every time. So far we have screened this many individuals and detected close to 4,000 individuals. And we don't stop there. So if somebody needs a follow-up for some high blood pressure or diabetes or some cardiac conditions or mental health conditions or eye conditions, we try to ensure that we intervene early. We provide the follow-up services with our local physicians, our community providers, and try to resolve those conditions as quickly as possible.
That would have been my question,
Yes.
Like after the screening, what is the step two? You have discovered some abnormalities in them. Then where do they go if they are uninsured?
Yeah, so in last 25 years, we have detected some cancers, some breast cancer, cervical cancer, prostate cancer, some severely abnormal cardiac conditions, some abnormal thyroid, liver function test, kidney function test, some significantly abnormal medical conditions, and we intervened. We called the local physicians for them to see them at a very low cost, or in some cases we provided that cost.
The event, the 25th anniversary gala, is on Sunday, November 19th at the Balaji Mandir Auditorium in Bridgewater, New Jersey, starting at 5 p.m. onwards. We'll have dinner, and then we have an orchestra from India who will entertain you. And we'll have fun evening. So come join us. Our website is ihcnj.org, www.ihcnj.org, and please buy their tickets or donate. And those, the physicians and other volunteers who just heard our story, this is going to be so unique, and it's a distinctive initiative and a very first for our community. Join us and help us, so that we can do this for our community.
And you can reach out to me, 848-391-0499, if you want to get more information about our event or the future plans of Community Health Center. And also, I want to thank all our dedicated volunteers, committee members, for your hard work, dedication, and community service for the past 25 years, and looking forward to your continued support.